News 5 is committed to following through on the stories that matter to our community. That's why, for the past several years, we have told you about ways communities are fighting against deadly opioid overdoses.
The hardest year of my life, my family's life, his friends' lives, really the whole community. He knew so many people, and it's been really hard on everybody.
Including installing naloxone lockers or Naloxboxes in common areas around the state. They've been rolled out in neighborhoods and on college campuses.
Being able to have naloxone available on college campuses is just another way for us to make sure that this life-saving medication is available.
And they're coming to more places like the Ohio Turnpike and CMHA housing.
So just how big of a problem are overdoses right here in Cuyahoga County? Take a look at this. According to the Cuyahoga County Overdose Dashboard, the number of deadly doses peaked in 2017 with 727 deaths. The numbers started coming down until it spiked again in 2021 with 675 deaths. Now, county officials are trying to address the problem in a big way, and I learned a partnership with CMHA has the potential to save lives when seconds count. CMHA residents now have another life-saving tool at their disposal. These Naloxboxes contain 2 doses of the opioid overdose reversal drug Narcan, and they're being installed in dozens of CMHA's 60 properties.
To date, we've installed a little over 100 boxes.
I visited CMHA's Cedar Extension high-rise building where the boxes were recently placed right above fire extinguishers on every floor. The installations come thanks to a partnership between the housing agency, Metro Health, the Adams Board, and Thrive.
We do have, those instances where people have overdosed, and that we do have individuals who need, assistance.
The newly formed partnership continues a project that launched in 2021 with the goal of installing 600 Naloxboxes across Cuyahoga County. Leaders within Metro Health's Office of Opioid Safety tell me CMHA properties are slated to receive about half of the boxes that will be installed countywide.
It'll be 300 or more boxes eventually. The original proposal was looking at 31 buildings throughout the CMHA property.
How did you determine which facilities within CMHA would get the naloxone boxes?
We made suggestions about the number of boxes that should be placed in locations based on the number of overdoses per building. We suggested the locations where there should be multiple boxes or only 1 box.
In fact, I talked with the director of the Cleveland Department of Public Health, and he tells me CMHA properties are some of the city's hotspots for overdoses. The data used dates back to 2011 and comes from the county medical examiner and EMS runs. The Narcan inside these boxes is to be administered in nasal spray form. CMHA officials tell me they plan to conduct free training sessions for their residents to learn how to properly use this drug.
Having more people understand what an overdose looks like or sounds like, and then understanding how to administer naloxone while waiting for EMS is going to make an incredible impact on saving lives.
I think having it right here, accessible where they live, creates something that removes huge barriers for our residents.
Now, Metro Health maintains and manages those Naloxboxes, and officials there tell me there have already been at least 2 instances where Narcan was removed from those boxes since installation started in early spring. So they're hoping that they're actually helping already.
Yeah, important work. We keep covering it.
For sure.